Hello everyone, welcome to another video. In today's video we're going to do introduction to population health. So public or population health is the combination of skills, science and activities directed to the maintenance and improvement of the health of all the people through collective or social actions. Therefore, public health is concerned with the improvement of health of populations or group of people rather than individual patients. So the population size can be anything. It can be groups of people, governments, entire countries, even the whole world or the whole globe. So if we look at this picture, on the left you can see a speed corp pulling over someone for speeding, drunk driving, no smoking sign, air quality, water quality, vaccines, cancer and food and nutrition signs. And all of these signs are in order to improve population or public health. The above mentioned signs is all signs for population health. So the maintenance or improvement of population health, and it's multidisciplinary. What that means is governments, communities, individuals, different sectors all are involved in trying to improve the health of the public. So the aim for population health is for healthy people and healthy communities. So if one look at this graph on the left, you see individual patient. You'll treat an individual patient, whereas in population health, you'll treat it differently. There's 3 steps. The first one is assess or diagnose. Then it's intervention, and then it's evaluation. So assess or diagnose is you'll assess or diagnose how healthy or unhealthy a population is, and you'll also diagnose the problems within the population. What is wrong? What is the health concerns? And then intervention. Intervention is what you'll do in order to tackle the health problems that you identified in the diagnose or assess phase. And then evaluation. Evaluation, you will reassess how effective was your intervention. Were your aims met? Are the health problems rectified? That's what you do in your evaluation. Okay, then if we look deeper into the diagnose or assess phase, is to make a diagnosis, you have to identify the main health problems within a community or population, and also you have to identify the extent of the health problems. How big of a concern is this health problems? You'll also have to make different measures, such as to determine how many people suffer from this specific health problem within a population, such as, for example, HIV. And also you're going to have to look at the distribution. Is where is this health problem mostly found? Is it in the urban or the rural areas? And also, what ages does it affect? What sex does it affect? Things of that nature. All of this will help you with your intervention. And also you have to assess the mortality rate. How many people die from this health concern or health risk? So the above mentioned diagnosis will help you decide if the type of intervention should be implemented to improve the health of this population. Intervention should focus on health problems that affect the most people. So the intervention should be made in such a way that it helps the majority of people, and also the intervention should focus on determinants. So what is a determinant? A determinant is a factor that contributes to poor health, such as a determinant can be anything. It could be weak air quality, or poor water quality, or poor road conditions, no water and sanitation, poor visibility. All of these things can be determinants, and your intervention should be directed to your determinants. So your intervention should improve your determinants. Okay, so in order to improve public health, one should constantly ask, but why? And also, once again, intervention focuses on the determinants to improve the water quality, the air quality, etc. So in public health, the causes and underlying causes should be tackled. first. So that's one of the main differences between public health and individual health. Is individual health, you go into a hospital or doctor, and the doctor will treat the symptoms and therefore also treat the disease. Whereas with public health, one looks upstream. One looks at the source of the disease and you tackle that. So you look at the determinants and you improve that, and therefore you will improve the health of the entire population. So that is the main difference between population health and individual health. Okay, then secondly, if we look at the intervention process, here's a chart. This chart is made by the World Federation of Public Health and Association, and it's also the WHO, the World Health Organization. They compiled this comprehensive approach in order to protect public health. So if we look here, the three in the middle, this is the responsibility of the core health service. So that is their responsibility, is protection, prevention, and promotion, the 3 Ps. So protection of disease, prevention of disease, or promotion of good health, or protection of good health, prevention of ill health. That is the core health science responsibility. So as one can see, it's the 3 Ps: promote, prevent, and protect. Then the outside 4 sectors is how we manage health, is how population health is obtained or maintained. It is through governance, information, capacity, and advocacy. So once again, it's governance, information, capacity, and advocacy. Those are the 4 that manage health. As we know that population health is multidisciplinary. So these 4 are responsible for population health. So who is responsible for maintaining and improving health? Is it individuals, communities, societies, or government? And it's actually all of the above. It's multidisciplinary. If you come back to this picture, you'll see earlier, these are, the first for the Sweet Carbon and No Smoking is promoting health by creating healthier environments, the water and areas for protecting health, and the vaccines and information is for prevention of disease. So once again, how do we manage health? It's those 4 things again. It is governance, information, capacity, and advocacy. And one also calls this public health enabling functions. Okay, so what does these 4 do? So governance is for public health legislation, health and cross-sector policy, finance and things like that. Capacity, how I remember capacity is how many people can our health service serve. So that's the workforce. How many is in the workforce planning, the resources, infrastructure, things like that. Information, surveillance, and monitoring. Advocacy is the leader, and ethics and things like that. So who is responsible for health? It's multidisciplinary, so it's individuals, communities, governments, and international bodies such as the World Health Organization, etc. And also the last passage, just to emphasize how public health or population health always looks upstream. Yes, I'm going to read you this passage. Three friends taking a walk in the mountains, some across a river. It's a beautiful scene, but it's shattered by the cries of several children in need of rescue in the water. So the 3 friends all jump right in along to rescue. The first friend says, I'm going to rescue those who are about to drown, those at most risk of falling over in the waterfall. The second friend says, I'm going to build a raft. I'm going to make sure that fewer people end up in the waterfall's edge. Let's usher more people to safety on this raft. Over time, the friends are successful, but not as much as they want to be. More children slip through. Finally, the first 2 friends look up and see that their third friend is swimming away from them upstream, rescuing children as she goes. They shout at her, "Where are you going? There are children here to save." And she says back, "I'm going to find out who or what is throwing these children in the water." And this is exactly what public health or population health also aims to do, is to look upstream, to find the source of poor health, to find the determinants and to fix those, and therefore ensuring or maintaining or even improving the health of the general public and the populations. Thank you for listening to my video. Like and subscribe.